I've been asked to talk in this second presentation about mental health and the history that CUSH has had with mental health in our community. Many times in the past decade, when we've broached the topic of mental health at meetings such as this one, we've decided that it was indeed an important topic, but we did not pursue the topic with a task force because there were other topics that were more urgent at the time. The last time we had a meeting such as this one, right here a while ago, we did pursue the topic of mental health for a variety of reasons. First, the COVID-19 pandemic had an intense effect on the mental health and well-being of most human beings on the planet, with Kenosha, Wisconsin being no exception. In addition to that, the last two community health assessments of Kenosha have shown that mental health and addiction is one of the top 3 most pressing concerns of those who participated in the assessment process. It's a public process. Also, in a Kenosha News article on April 24th, 2023, Frederick South's president and CEO at the time, Rick Schmidt, announced that the Palmer wing of the former Kenosha Hospital would be utilized for mental health and rehabilitation services, providing an inpatient mental health facility. The article went on to say that Frederick South's plan would convert underutilized space in the downtown hospital to inpatient and outpatient mental health services and inpatient rehabilitation services, end quote. At that time, a task force was formed in CUSH to advocate for Frederick South to follow through on their promise to the community. Those who served on that task force had lived experience in advocating for their own loved ones who had used inpatient rehabilitation services at various times in their lives. That task force met with the team from Frederick South that was assigned to make the project happen for the next year and a half. That task force also met with Mayor David Bogdala to seek his input and insight into how to increase the mental health services that are currently lacking in Kenosha. Frederick South announced on July 21st of 2024 that they and Guardian Recovery, a national behavior health care provider, would open a drug and alcohol treatment facility in Kenosha. The facility was set to open this summer of 2025. While a 72-bed facility in the Palmer building at the Frederick Kenosha Center downtown will be useful in Kenosha, it's not what Frederick South promised to the mental health commitments of our community. In the face of a shortage of medical mental health providers, new ways to address mental health continue to gain traction. The Wisconsin Peer Specialist Employment Initiative, which we abbreviate WIPSE, works with the Wisconsin Department of Health Services, DHS, to be a central point of contact to provide information and assistance to increase the capacity for employment of certified peer specialists, CPSs, and certified parent peer specialists, CPPSs, and provide education and technical assistance to counties, tribal nations, and other agencies. I've thrown a lot of initials at you rapidly. Let me try and break some of that down. Certified peer specialists and certified parent peer specialists work with those who are dealing with mental health issues and substance use issues. They do not provide medical diagnosis, medication, and therapy, but by serving as a peer with lived experience, someone who can listen carefully, provide resources when asked, and help a person to make short-term and long-term plans for their life. Certified peer specialists know that the person seeking assistance is the expert in their own life and their own well-being. That person is never told what to do by a certified peer specialist. Advice may be offered to the one seeking assistance when permission is given. Certified peer specialists can be particularly helpful to veterans, people who are LGBTQIA+, and to others who are at high risk for self-harm and addiction because of their lived experience in horrifyingly adverse situations. I was trained as a certified peer specialist. In addition to increasing services for those living with mental health concerns, increased awareness and common sense behavior can help lessen the stigma of mental health dis-ease. An organization called Mental Health First Aid USA offers a course in being trained in mental health first aid. Much like giving first aid to someone who has had a medical crisis, Mental Health First Aid teaches caring individuals how to assess for risk of suicide or harm, how to listen non-judgmentally, how to give reassurance and information, how to encourage someone to seek appropriate professional help, and how to encourage a person dealing with mental health issues to practice self-care and seek other support strategies. What strides in mental health support and awareness might we make if we advocated for and became involved in these emerging strategies in response to our current critical shortages in mental health care providers? I leave that as an open question for all of us. Thank you.
Thank you. Do we have any questions for Pastor Kathy?
So you mentioned that you spoke with the mayor. Did you speak with the county executive or the head of Department of Human Services that would, be delivering those kind of services usually?
We did speak with John Jensen, the head of the Department of Human Services, and he had ongoing interaction with the CEO from Frederick South, too. That came to just be a dead end for us as far as getting inpatient mental health in the community. And we did not speak with the county executive because it's a city property, the Palmer unit in the downtown Kenosha Hospital. So they have no business determining what goes in that building.
Other questions?
Veronica has one.
Hi, I was just curious. Forgive me for not Googling this question in advance, but I work in mental health myself in Illinois, and one of the services we offer is walk-in services for therapy. And I've always been kind of curious at why that's so difficult to find in Wisconsin, and I didn't know if you had any further insight on that.
Part of my understanding from working with this issue with CUSH over the years has been part of it has been a back and forth between the county and the cities. Who's going to take that up? The changeover in human development on the county level, John Jansen has remained constant. He's been there for a long time. But the people who work under him have changed. It's been a revolving door, if you will, of people to oversee the services for the county. That's part of the issue, but another part of the issue is there's just tremendous shortages all over the place in mental health providers, especially on the traditional medical approach of psychiatrists and psychologists and physicians determining what disease you have and then giving you a medication for it, and then giving you a course in therapy about it, the traditional medical approach. The evolving peer support approach is now being used in combination with the medical support, the medical approach, because a lot of independent therapists are finding that they just don't have other therapists to work in their office with them. There's just a tremendous shortage, and peer support specialists are being used as a point of contact between people who are at risk, a point of contact of, let's at least get this person someone who can help them plan, help them prevent, have less harm to themselves, those kinds of things. Does that answer your question? And the county is very grateful to Northern Illinois, actually, Kenosha County, because the state of Illinois changed their laws. We can now transport people who need to be involuntarily placed in inpatient services across the border into Illinois. And the Kenosha County advocated for that change in Illinois law because the place where almost all of our inpatient admissions were going was up to Oshkosh. And that involved people from the police department to escort someone. Psychological emergencies, mental health emergencies usually don't happen in the middle of the afternoon. They usually happen late at night or in the morning. So we're talking lots and lots of overtime. And it was horrible for the families and for the people that were experiencing that trauma. Being in an inpatient facility, if it's not your idea, is a traumatic thing. And it's even more traumatic to ship somebody with a couple of cops 3 hours north of where you are. Your family, how are they going to get there to visit you? You know what I'm talking about. So we're grateful to Northern Illinois because now people can be much geographically closer to the person who needs inpatient services.
I think we had one more.
Veronica had one.
Back in May of this year, I completed that mental health first aid training through Milwaukee Area Technical College as an adjunct instructor. Great. My question is would CUSH be interested in asking the county to cover the cost of the training and having it done for CUSH volunteers that are interested in mental health
I would love
training?
to say yes, but that would be dipping into the same bucket twice. And I don't know that the county is going to do that, because part of what I did not say in my comments was when I was trained, I talked about being trained as a certified peer specialist. I was also trained in 2019 to be a instructor of mental health first aid.
Okay.
As were about, I think there were 14 or 15 of us in Kenosha County, and Kenosha County paid for that. But then COVID happened. How many times have we said, then COVID happened? So I don't know how many of those trainers are still in the area. I am no longer certified to do that because of COVID, the course is no longer in person. It's now a hybrid of in-person and virtual. Yeah. And that requires the trainers to be retrained to do that. And I have not, because of other things going on in my life, I never pursued being retrained to instruct in that context.
You know, or either Gateway or Parkside might be an option too, because I literally got this training through a technical college, so it's worth pursuing. I have the contact information for the trainer that provided this training for us.
That's wonderful. Yeah, that can be the start of a conversation.